Hello, I am Dr. Reshik Kannan, consultant neurologist in Fortis Hiranandani Vashi Hospital. So today I am going to talk about vertigo, how common is vertigo, how serious it can be. So vertigo is a very common symptom. In fact, 20 to 30% of general population suffer from vertigo at any point in their lifetime. The symptoms of vertigo can be dizziness, imbalance, spinning sensations, and these symptoms can be episodic, these symptoms can be persistent, these symptoms can be acute, these symptoms can be chronic also. The most important point when it comes to vertigo is we need to find out whether these vertigo is how serious the vertigo symptoms can be. So there is something known as posterior circulation stroke, which can lead to symptom like vertigo, where patient can have sudden onset spinning sensation. Patient can also have imbalance. Patient can also have fall. Second thing, there are certain other conditions which are related to vertigo. The most common conditions where vertigo can be seen is benign paroxysmal positional vertigo, vestibular migraine, Meniere's disease, and vestibular neuritis. So in all these conditions, vertigo can be seen. The most important thing where we need to focus on is the associated symptoms with vertigo, wherein, for example, in vestibular migraine, headache is something which is commonly seen along with vertigo. In benign paroxysmal positional vertigo, usually patient complains of vertigo when they are on lying down position. They feel dizzy, they feel that the roof is spinning. Also, there is something known as vestibular neuritis, where patient will have vertigo associated with tinnitus, that is an abnormal ringing sound in the ears. Along with that, patient will also have impairment of hearing, which is seen in labyrinthitis, where vertigo can be seen. There is something known as Meniere's disease, where vertigo will be seen associated with tinnitus, associated with hearing impairment, sudden onset vertigo lasting for almost hours, and then these episodes are very episodic. They are not persistent. So these are the common conditions where vertigo can be seen. Now the most important thing is whenever you feel that you are having dizziness or when you are having vertigo like symptoms, the first thing what you need to do is you need to meet a neurologist or you need to meet a vertigo specialist so that we can find out what we are dealing with, because it is very important to find out or detect a serious condition known as posterior circulation stroke, and we need to tackle it as soon as possible, because as you know, stroke can be very serious and it can lead to permanent functional disability. Now when it comes to treatment of vertigo, there are various types of treatment, and the treatment depends on the condition what we are dealing with. For stroke, we need to give blood thinners and we need to do intervention sometimes if needed. There are anti-migraine treatment for vestibular migraine. For vestibular neuritis, we need to give some acute symptomatic treatment where patient will have resolution of symptom after few weeks. For Meniere's disease, there are conservative management as well as surgical treatment which will help in resolution of symptoms. In vertigo, the main treatment is medical, the main treatment is surgical also if needed, and there are vestibular physiotherapy, vestibular rehabilitation, which will help patient to cope up with these symptoms in day-to-day life, which is a very essential part of treatment. So as we spoke about vertigo today, it is very essential to meet a neurologist or a vertigo specialist for your vertigo symptoms. And can we meet or take an appointment with a vertigo specialist for your vertigo symptoms? Thank you.